Hey guys, welcome to my channel Learnovate. Today we will going to discuss the views of the skull in respect to the frontal position, superior position, lateral and the occipital and the basalis view. So in this video we will going to discuss the norma verticalis or the norma superialis that will actually forming the skull cap or the calvaria. So this is the norma verticalis or the norma superialis. In this norma superialis or the skull cap, we can see the bones from anterior to posterior. This is the frontal bone that is forming the anterior part of the skull cap. The frontal bone is unpaired bone and articulate with the two paired parietal bone with the suture called as the corner suture. This suture is called as the corner suture. That is the meeting point for the frontal and the two paired parietal bones. Posterior to the unpaired frontal bone are the two paired parietal bones that are meeting at the point of the sagittal suture. This hole is the sagittal suture. You can see here this sagittal suture is going from the anterior towards the posterior direction, and then at that side it will meet with the occipital bone at the lambdoid suture. So the sagittal suture is the middle suture that is joining the two parietal bones with each other. And this suture have one important landmark, that is the two parietal foramens that are located laterally to the sagittal suture. Now the anterior part has been discussed, that is the unpaired frontal bone forming the anterior part. The middle part is formed from the two paired parietal bones, and the posterior or the occipital part is formed from the occipital bone or the occipital bone articulating with the paired parietal bone at the suture. This suture is called as the lambdoid suture. As the shape is lambda like, so it's called as the lambdoid suture between the parietal and the occipital bone. So these are the three main sutures that are present in the skull cap from anterior to posterior. Two more important landmarks are present here is the area of the junction between the sagittal and the corner suture is the bregma. This point is called as the bregma, which was the earlier fusion of the anterior fontanelle that were present in the young baby or young children, but at the adulthood it gets fused and form the landmark that is called as the bregma. Posteriorly from the sagittal suture, we can see here when the sagittal suture fused with the occipital bone at the lambdoid suture, this point where the lambdoid and the sagittal suture fuse is called as the lambda. This lambda is also our landmark or bony landmark, is the formed from the fusion of the posterior fontanelle that was present in the young children. So this is the norma verticalis or the norma superialis. One more thing is the most important part of the skull, that is the most superior part of the skull, which is the pointed tip in the skull at the norma verticalis. You can see here this is the pointed part. This pointed part in the norma verticalis is called as the vertex, the highest point of the skull or the skull cap. From outside this bone is like this, and from the internal view we can see these sutures are also making the structure suture inside the skull cap or the calvaria. Thank you for watching our video.